It is important that we know about food safety. Foodborne diseases affect about 1 in 10 people worldwide every year.
Foodborne illness kasi it has a variety of reason. It can be from viruses, bacteria, even fungal, even parasite.
Some say we are what we eat. When we eat healthy, we stay healthy. But the handling and preparation of our food is equally important to our overall health. In fact, the World Health Organization reported that almost 1 in 10 people around the world fall ill after eating contaminated food. Let's discuss safety measures in handling, cooking, and storing our food in order to avoid foodborne illnesses. I'm Dr. Freddy Gomez. Welcome to Med Talk Health Talk. Food is essential and we all need it in order to survive. But access to good, clean, and healthy food is what is most important, and that's what we want to start with. So to tell us more about this, let's welcome Dr. Jose Carlo Tirante, who's a family medicine specialist from UniHealth Parañaque Hospital and Medical Center. Now, I'll start with first, why is it important for us to be aware of food and water safety?
Food safety is very important that we are aware of it, because unsafe and contaminated food gives rise to a lot of foodborne diseases. It is important that we know about food safety. These diseases affect about 1 in 10 people worldwide every year, and it's responsible for about 200 or so foodborne diseases. We have to be very conscious about food safety, and basically because food sustains life, and also it is very essential, for health.
But when it comes to food safety in promoting yung health ng isang tao, is this important? Is this, kumbaga, vital? Kasama rin ba ito? Does this fall part and parcel with having good health with safe food?
Yes, the requirement of optimum health is that you are well nourished and you are taking in food that is free from disease. So therefore, if you have good, nutritious, and food that is free from disease, then you more likely ensure a person that is healthy, and therefore you have less days that you are sick.
Now, what are some of the different factors that may affect the safety of food?
The different factors that affect the safety of food is, especially in our country, is temperature and time. So germs and bacteria, they really love temperature between 5 degrees Celsius and 60 degrees Celsius. And this is what you call your temperature danger zone. And what we really need to do is to make sure that food, especially high-risk food like meat, chicken, and fish, not stay within this temperature danger zone. You can reuse these types of food within 2 hours or refrigerate them within 2 hours, to use or eat them within 2 to 4 hours, and to dispose of them at 4 hours thereafter.
Now, I'm sure a lot of our viewers here have at one point or another prepared food. I'm sure a lot of viewers have prepared food for a long time. But what are some of the household practices, kumbaga, na hindi siguro nare-realize masyado that can actually compromise food safety?
It's very easy and simple to make sure that our food are safe. First, you have to clean your hands before, during, and after handling food. And number 2, you have to make sure that your utensils are not dirty. Make sure that your vegetables and fruits are thoroughly cleaned, also with running water. Separate the raw meat from your cooked meat. And of course, when you do your groceries, make sure that the vegetables and the raw meat are separate. And use your different chopping boards and different knives for different types of food like meat and vegetables.
Okay, pinag-usapan natin, Doc Carlo, the importance of food safety. Is that by and far the most important thing? What about nutrition? How does nutrition fall in as important as well, like food safety?
Yes, food safety and nutrition is very linked, because in order for us to have optimum health, you really need to have food that is free from disease, and you have to make sure that this is nutritious. And of course, if you give something that is contaminated, you have food that is contaminated, this starts this vicious cycle that if a pregnant person, for example, intakes contaminated food, you have decrease in absorption. If you have decrease in absorption of your nutrients, you have negative effects on the fetus, negative effects on growth of children, and of course, for people who are sick and elderly, it takes a longer time for them to recover from sickness.
To sort of summarize this segment, what can you say about the importance of being aware of food safety in both our health and nutrition?
Keep clean, Make sure to separate your raw food from your cooked food. Cook properly. Keep food at very correct temperatures, and make sure that you have clean water and materials when preparing your food.
And if our viewers have any more questions on the importance of anything that you discussed, always have a good relationship with their doctor, with their physician for correct and proper information.
Yes, always ask your physician for advice. They're there to help you, and they're there to help you be healthier and stronger.
All right. Thank you so much, Doc Carlo Turante, for joining us and giving us that awareness on how important food safety, food and water safety is for all of our health.
Thank you very much, Dr. Gomez.
Food and waterborne illnesses, I'm sure, are very familiar to our viewers, and at one point or another, you may have experienced some symptoms of this. Now, here to tell us more about that, let's welcome Dr. Cristel Medina, who's an infectious disease specialist from the University of Santo Tomas Hospital. Now, pag-usapan natin ang foodborne illnesses. Pare-pareho lang ba ang organism pagkain na panis, hindi maganda yung pag-prepare? Pare-pareho lang bang symptoms na mararamdaman ng isang tao?
When it comes to the question of pare-pareho bang organism, relatively hindi. Kasi it depends on the kind of food that you take. Ang foodborne illness kasi, it has a variety of reason. It can be from viruses, bacteria, even fungal, even parasites. So it's really a variation po. So in terms of symptomatology, it can be very mild. Like for example, with what we see with norovirus. Noroviruses, basically, symptomatic, ano lang siya, more of parang hydration lang. However, there are some notorious microorganism that can cause sloughing off or madedegrade or madedestroy yung tissue na intestine, causing bloody diarrhea. That's one of the symptoms for severe illnesses. Worst case scenario, there are some organisms like your salmonella, your enteroinvasive E. coli. It can cause bacteremia. When we speak of bacteremia, your microorganism has already breached the blood vessel. Hence, it can go around the circulatory system. Sometimes, worst case scenario, it can seed through the different organs.
Meron bang way na malalaman or dapat kagad pag meron akong naramdaman pagkakaiba sa aking pagdumi or nag-vomit ako, nagsumuka ako, kailangan magpa-check na ako kagad?
Basically, number one, very good history. Of course, we have to take note, ano ba yung kinain muna niya within the past 24 to 48 hours. Sometimes in salmonella, the incubation kasi ng salmonella, it can run as long as 1 week. So we always have to deal as long as that. So we have to do a very good history. Pangalawa, if the patient is already having febrile episode concomitantly with the diarrhea, or the patient is having bloody diarrhea or any signs of dehydration, mas magandang magpakonsulta na sila kagad, because other than the fecal analysis, we can also do stool culture for us to know what specific microorganism has caused the symptoms of the patient.
Now, one of the common things that people use in order to distinguish whether their food is okay to eat or not is one of their powerful senses is that of smell. So, inaamoy muna nila. So, pag-usapan natin, hindi yung sobrang amoy hindi na dapat kainin, pero yung medyo alanganin. Parang pwede pa, hindi pa ganun kalakas yung amoy ng pagkapanis. Pwede ba itong idaan sa pag-init? Safe bang kainin ang merong konting amoy na pagkain?
Pag nagkakaroon na ng amoy yung pagkain, ibig sabihin, there are possibly some organisms that ferments, has this parang mechanism for fermentation, so they can produce that specific kind of smell. So kapag medyo nag-iiba na siya, actually even reheating will not do any further good, so mas magandang i-discard na siya. Pero basically pa rin syempre, ang kailangan natin when we have different foods at home, the most appropriate way to deal with that is to put labels kung kailan mo ba siya ginawa. Kasi importante siya. Let's say, the food is already there like 1 week ago na. So, tas nagkaroon ng amoy. So, automatic, kailangan i-discard na natin yun because the possibility of having it contaminated mas mataas. So, food labels are a very good practice in our household. So, I think isa yun sa magandang gawin sa bahay. Basically kasi, when a food is maintained in a room temperature, let's say perishable food in a room temperature for at least 2 hours, that it's already a risk for some microorganism to grow in that food.
Pag-usapan naman natin, Doc Tel, ang food preparation. Ano ang pinaka-common way for bacteria, for something that is not good for the body to enter that food that is prepared? Because marami dyan, meron yung food handler, meron yung type of food na ginagamit, meron din mga nadapuan ng langaw, yung pagkain, pwede na bang magkasakit? Which is the more common way in which becomes contaminated?
Number one, of course, the handler. If there is no proper hygiene with the handler, meaning it doesn't have a good cleaning of the utensils prior, it can be already a risk factor for contaminating the food. Second, there is such a thing as we have to separate food all the time, meaning we should avoid cross-contamination. If you have food that are raw, always separate it from ready-to-eat food. Sometimes when you have to store it inside the ref, make sure that your marinated meat, it's tightly sealed so that its juices won't leak to the ready-to-eat food. So I think that's one of the most common reasons for contamination, the handling of the food, the hygiene around the place, and of course, the cross-contamination in between raw food and ready-to-eat food.
Regarding the food handler, hindi maganda yung hygiene ng food handler, pero bagong luto, safe ba kainin yung pagkain?
Basically, the first etiology that I said a while ago, the norovirus, actually, according to studies, the food becomes contaminated if the handler is contaminated or having, let's say, he is having bouts of acute diarrheal illness during the time that he is preparing the food. That's a risk for acquiring norovirus as well. So, even if the food is adequately prepared, if the handler is infected, it's still a means for transmitting or contaminating
So, pwede
the food.
pa rin
Pwede
maging
pa rin.
hindi maganda yung pagkain. Marami talaga tayong natutunan sa inyo, Doc Ted. We will continue that. We will be talking more about how to properly handle food, especially ano ba yung best baon na ibigay para sa inyong anak or sa inyong loved one. That is what MedTalk Health Talk will be talking about when we return. Food and beverage can be a breeding ground for a lot of bacteria. Now, proper handling is definitely key here, and finding out what to use and how to prepare them will definitely go a long way for your safety and your health. Now, continuing this conversation, we're still with Doc Tel. Doc Tel, when it comes to food preparation, one of the more common breeding grounds for unhygienic food is that of street food. Now, nowadays, I don't want to give street food a bad name. They're doing more to be more hygienic with regards to street food, but still, there is some risk to eating street food. Is it possible na ma-immune ang isang tao sa, like what you said, with street food, with food that may have some bacteria, like what you said, like the mild ones that can be present? Is this a safe notion to understand? Hindi na ako maapektuhan yan.
Kasi immune
Makapal na
na.
yung tiyan ko sa mga ganyang klaseng pagkain.
It's a very common misconception. There's no such a thing as immunity sa mga street food kasi na-expose ka na doon. So basically, with organisms or any infection kasi, we have to understand that there is such a thing as incubation period, meaning from the time we took in the food and then the manifestation of the symptoms, and there is such a thing as duration of illness. And then kapag natapos na yung duration of illness, hanggang dun na. Wala silang kakayanan magkaroon tayo ng antibodies, except siguro kung hepatitis A. Pero the rest of the bacteria, the parasite, fungal, wala tayong antibodies to that. So kung wala tayong antibodies, wala tayong immunity. So the possibility of having repeated, recurrent infection with the same microorganism, andyan yun. Walang sinasabing makapal na yung tiyan, walang ganun. So, ang iiwasan lang natin doon, syempre, kapag paulit-ulit, baka mamaya ma-push to with severe manifestations, which is ayaw natin.
When it comes to ano bang klaseng pagkain ang best na dalhin ng pambaon, kumbaga, what are some tips that you could advise those who are preparing food at home? What are the best kinds of food and what are the types of food to avoid na gawing baon?
In terms of gawing baon, syempre, pag sinabi kasing baon, you are not going to consume it immediately. So, basically, sa school children, mga 4 hours pa yan or 2 hours before mag-recess or 4 hours kapag sa trabaho. So, as much as possible, microorganisms, isipin na lang natin ang microorganisms parang tao, mahilig sa asukal. So, avoid na lang high in carbohydrates or highly sugary-rich foods for that. Pangalawa, avoid then foods that are masyadong moist, madaling mag-accumulate kasi ang bacteria kapag sobrang moist ang pagkain. So, lalo at kapag ito ay makukulob sa mga baunan, so mas madali silang pamagaran ng infection. So, pangalawa, kung magkakaroon man tayo ng mga containers, there are mga parang containers that are insulated para at least andun pa rin yung warmth para at least there is less risk for microorganisms to grow.
Ano ang food poisoning, Dr. Tel? Maraming kasing minsan confused, feeling nila na food poisoning sila. Anong ibig sabihin nito at paano natin malalaman na indeed food poisoning ang nangyari sa kanila?
Actually, I think food poisoning is a very layman term that most of the people use for foodborne illnesses. However, it is highly suspecting that the patient is having food poisoning. Number one, if by history, all of the people who took the same food at the same time develop the symptoms. So parang kailangan ko i-emphasize yung temporal pattern. Hindi po pwedeng ako yung kumain lang ng manok, the rest kumain ng manok, wala naman sila, pero ako meron. So parang medyo in doubt pa ako na food poisoning yun. So kumbaga, temporal pattern plus all of the index people who ate the food, we can consider that as food poisoning.
Along those lines, with poisoning, maraming tumitingin siyempre sa expiration date. Medyo related to sa food, pero ang gamot. Minsan, ang gamot natin, meron expiration date dyan. What if one of our viewers, meron silang vitamins or even antibiotics na lampas na sa expiration date? Malalaso na ba ang isang tao kapag ininom nila ito?
Yung mga best before, it speaks about the quality, not the safety. So technically, safe siya, pero yung kalidad mas mababa na. Kumbaga parang hindi na siya out of 100% na ideal na efficacy ng gamot, mas less na lang ang makukuha. Kumbaga 50% na lang if it's beyond the expiration date.
Now let's go over to leftover food. Ito paborito nito, yung mga hindi naubos na pagkain the day before, iinitin ulit. What are some tips na dapat malaman regarding leftover food?
With leftover food, of course, number one, you inspect what's the quality of the food. Second, if you have to reheat it, there's certain temperature that is allowable for consumption after reheating. Then if it's not consumed, then just discard it. Because there can be more harm if we keep on reheating food than the benefit that it can give the people.
Napakaganda talaga yung information and very practical. I'm sure a lot of our viewers are more knowledgeable now whenever they prepare the food and how they consume it. Any tips, any advice para sa mga viewers natin?
You have to clean your space, of course. So basically, the viewers must understand that the mode of transmission of foodborne illness is fecal-oral route. So basically, we can prevent that by practicing personal hygiene. Separate the raw food from the ready-to-eat food because raw food is a good breeding ground for microorganisms. Cook it at the right amount of heat. So, for the different kinds of meat, it has this certain temperature for the microorganisms to be dead. So, for the usual pork or beef, it should be more than 145 degrees Fahrenheit. For the ground meat, it should be more than 160 degrees. For poultry, for chicken, and for the leftover, it should be more than 165 degrees Fahrenheit. And then, yung last is to chill the food. For example, you are not going to consume the food right ahead. You have to store it in the refrigerator or freezer because there is what we call the danger zone. That is keeping the food for more than 2 hours in a temperature more than 40 degrees Fahrenheit and less than 140 degrees Fahrenheit, meaning in a room temperature. So specifically sa mga perishable food, madali silang makontaminate kapag hinayaan natin na ganoon po.
Well, like what you said, when in doubt, it's better to discard because the benefits will not outweigh the risk in that matter. Thank you so much, Dr. Tel Medina, for joining us and sharing expertise to our viewers. I'm sure maraming may natutunan sa'yo. Again, food safety is very important, from handling to preparation to storage of food. Let's work together in order to avoid food and waterborne illnesses. I'm Dr. Freddy Gomez, and thank you for joining us here on MedTalk Health Talk.